Welcome, everyone, to Employee Benefits Implications of the 2021 Government Funding Bill. Thank you again for joining us. Our moderator for today's call is Jill Brooking. She will be answering questions you send through the Q&A today. We will try our best to answer all of your questions, but if for whatever reason we are unable to get to your question today, please follow up with your advisor for further assistance. Today's presentation is being recorded, and within 2 business days after this call, you'll receive a follow-up email from MST Learning with links to both the recording and the slide deck. As an additional resource, our team has prepared a white paper on the subject matter, which has been shared in a link in the chat below. At this time, I'd like to introduce our speakers for today's webinar. Joining us today are Beth Allen, Patrick Myers, Carol Wood, and Diane Cross for NST's Benefits Compliance Department. We are very excited to have them speaking with us today, and it is my great pleasure to hand the call over to our speakers. Beth, the floor is yours.
So we're going to kick it off because we have a lot of material and not a whole lot of time today. And so just to start off, as we always do, I have to give you the disclaimer that obviously we're not your accountants or attorneys. And so anything that we say today is specifically for just your general guidance. The people who are going to be speaking today, there are 4 of us. That's myself, Beth Allen, Diane Cross, Patrick Myers, and Carol Woods. And we undertook this presentation this way with 4 people because this bill was crazy. It was almost 6,000 pages and it was a whole lot. And so to basically be able to get this presentation out to you as quickly as we're able to share it, it is something that we kind of separated and really worked together. Okay. And so as far as an agenda, I'm going to go through quickly just the bill and how we got here very quickly. And then we're really going to go into a number of the provisions that I'm sure all of you are going to be asking about. And I will say on the onset, that some of these are obviously bigger topics than others. And so we're not necessarily going to devote the same amount of time to each of them, but we do look to spend more time on the ones where we know that employer plan sponsors are going to have questions. And so with each of these topics that you see, beginning with the FFCRA extension, non-extension, and going down to retirement-related provisions, we're going to try and focus on kind of what's in the bill, how it's different from what was in place before, and then identify any employer action that might apply for that particular provision, okay? And so that's what we're going to be looking at. Now, mind you, with most of these, I've tried to indicate kind of a bottom line. And the term bottom line actually comes from my son's Sunday school class. That's kind of what they teach them, is like the one thing that they're supposed to take from the kid message. And so when you think about these topics, when you see the bottom line, that's really what we want you to know leaving today about that particular subject. Mind you, we're going to try and take questions, but there are over 1,000 of you. And so I'm going to be honest and say we're going to probably take a few questions up front after the FFCRA section and the section on FSA and DCAP Relief. But after that, we're going to hope to hold questions until the end of the presentation. And then also, just to kind of move on, keep in mind that we're discussing the benefits related parts of this bill. We're not going to go into some of the other stimulus. So for example, PPP, the extension of that, and questions about COVID vaccine testing, COVID vaccine and testing. We're not going to go into those, but look out for additional, NFP resources about those parts of the bill in later weeks. So let's go ahead and get started. And just with a quick overview of the bill, this is basically the annual budget bill that was signed into law in December 27th, and it funds the government. And particularly this piece of the legislation was kind of tied in with the annual bill, but was designed to provide COVID-19 relief for the most part. And so, as I mentioned, there were some parts of it that allowed for, vaccine and testing provisions. As you all know, individuals and small businesses are going to receive some stimulus from the package, but we're really going to focus on just the benefits related provisions of it, because obviously, we help you out with employee benefits. And so that's what we are going to do there. And so to move on, I am going to just open it up by talking about, or inviting Patrick to talk about, the FFCRA extension, non-extension. And I called it that for a reason. Patrick, can you share kind of why we looked at it that way?
Thank you, Beth. This particular provision of the legislation, the FSCRA is not technically speaking extended. That is, the mandatory portions of FFCRA are not extended. What it does is it gives employers the opportunity or to voluntarily extend the leave granted under the original FFCRA past the December 31st, 2020 deadline to March 31st, 2021. They're not required to do this, but they are allowed to do that. If they do choose to do that, they can continue to apply for the tax credits that were available to them last year under the FFCRA. And again, this is going to be through March 31st, 2021. And keep in mind that even though this is a voluntary thing and not mandatory, state leave may still apply to you. So employers should consider any state or local paid or sick or family leave requirements, as well as their own paid sick leave policies before making any changes. The other thing I wanted to add on this one, just briefly, is that the Department of Labor has provided 2 FAQs on the topic of this extension, non-extension, that we've posted a little article about that on this week's Compliance Corner, but we will provide you a link to those FAQs in the slides, so you can refer to them later if you wish. Now, it may be continued through March. Employers can then claim a tax credit if they do extend it to March, but just remember, it's not required. Next slide, please.
And Patrick, I'm going to just stop you there really quickly. You talked about how it could be continued through March, but it's not required. I think inevitably someone's going to ask the question, could a particular employer choose to, let's say, offer the FFCRA leave for, the emergency paid sick leave reasons, such as actually being sick with COVID, but then not offer it, for example, for childcare? Thoughts?
At this point, we simply don't know exactly how much flexibility employers are going to have in this regard. We simply don't know. So far as we can tell, the extension or the opportunity to extend to the end of the quarter doesn't have any other provisos or anything else attached. We may have to wait for additional guidance on that.
Great. All righty. So that is the FFCRA extension, non-extension. Jill, were there any questions that you want to shout out really quickly just about that you see in the inbox?
No, just so thank you.
Sure. I do see one question where someone asks, how do we communicate to employees and or document if we choose to extend FFCRA? Patrick?
Again, we don't have any guidance on that. It's a good question. We just simply don't know at this point what they intend for us to do.
Yeah, I think that's a good point. We don't really have any, guidance from the DOL on this particular topic. I would say it, as we always generally tell people in compliance wise, is that you want to make sure that when you communicate it, that you communicate it to everyone, right? So you don't want it to be one of those things
Right.
where it comes off being inconsistent because you communicate it to some employees, but not others.
Right.
So you want to be careful about that. And otherwise, we just don't really have a whole lot of guidance on it right now.
We sure don't.
So in the interest of time, we're going to move on. And like I said, we'll be in the Q&A box answering your questions for the rest of the presentation. So this is another big subject. And that is basically, the FSA and DCAP relief that we got from this bill. Now, I will say up front that as compliance people, we spent all year last year pretty much telling you guys that the FSA and DCAP rules were a certain way. And this bill basically came out and changed all of that. So don't shoot the messenger because it just changed it for us. But Diane, do you want to kind of start off by giving us an introduction to kind of some of the terms that people need to be familiar with?
Sure. Thanks, Beth. I appreciate that intro, especially the don't shoot the messenger part. So before digging into the FSA and DCAP relief provided by this new law, we should probably review the basics of FSA and DCAP terms and features, really so we can better understand the impact that the FSA and DCAP relief provides. So as you may know, health FSAs and DCAPs are subject to a use it or lose it rule, meaning unused benefits and contributions that remain at the end of the plan year are forfeited. They're lost, right? But now the remaining amounts at the end of the plan year are still subject to a runout period, which is the time period immediately following the end of a plan year where participants can submit documentation for reimbursement of eligible expenses that were incurred during the plan year. So let's take, for example, a calendar FSA will often have a 90-day runout period, so through March 31st of the following year. And that is where participants can submit for reimbursement of those eligible expenses that were incurred during the period of coverage. All right, so we have the use it or lose it rule, the runout period that's in play. Now there are two exceptions to that use it or lose it rule, and that would be either a grace period or a carryover provision. Now, a plan can adopt one or the other or neither, but it cannot adopt both. So what's a grace period? A grace period allows unused amounts remaining in an FSA and DCAP to be available to pay for qualifying expenses incurred during the plan year for up to 2.5 months following the end of that plan year. So let's take our calendar year FSA example with a grace period provision. The FSA can be used to reimburse expenses incurred through March 15th following the close of the plan year. So it's extending the time period where expenses can be reimbursed, kind of functioning like a 14.5-month period of coverage. Now, a carryover, or also referred to as a rollover, so a carryover feature allows unused amounts remaining in accounts at the end of the plan year, up to $550 as indexed annually is allowed to be rolled over or carried over for qualified expenses in the following year. So in other words, FSA funds up to a certain limit are carried over into the next year, but only health FSAs can offer a carryover provision. This is not applicable to dependent care FSAs or DCAPs. So, however, there are, while DCAPs cannot generally permit a carryover, they can permit a spend down provision, and that allows employees who have ceased participation in the DCAP to be reimbursed from their remaining DCAP funds for eligible expenses incurred during the remainder of the plan year. So let's take an employee maybe terminated in May with a DCAP balance of $500. Those funds could be used to reimburse eligible expenses through the end of the plan year. And this feature is unique to DCAPs. It's generally not applicable to FSAs. All right, so that's our speed round 101 of FSAs and DCAP terms and features. And now that we have that under our belt, let's look at the FSA and DCAP relief provided by this new law. So first, let's review the provisions that impact both FSAs and DCAPs. So we have an extended carryover. Now, FSAs and DCAPs are permitted to carry over any unused funds to the following plan year. This is temporary relief, and it's applicable for plan years ending in 2020 and 2021 only. As we just reviewed, prior to this relief, carryover feature was limited to FSAs only, and the amount was indexed and capped at $550. But now, with this new law and this new relief, the DCAP sponsors are temporarily permitted to adopt the carryover feature, and both FSAs and DCAP's carryover amount is not capped. So for example, let's take an FSA participant with, let's say, $1,000 remaining at the end of a plan year that ends at any point in 2021. That participant, if the employer chooses to implement this relief, can carry those funds into the next plan year. We do want to point out that this carryover amount, these carryover amounts, so for example, it was $1,000 in the previous example, they do not impact the contribution amount or salary reduction for the following plan year. And an FSA can condition the ability to carry over unused amounts on participation in the FSA in the following year. All right, so we have extended carryovers that impact both FSAs and DCAPs. We also have an extended grace period. For plan years ending in 2020 or 2021, grace periods can be extended up to 12 months after the end of the plan year. and this can apply to both DCAPs and FSAs. And as we just reviewed, prior to this relief, grace period could only be 2.5 months. But now an FSA or a DCAP participant can have essentially up to a 24-month period of coverage to incur claims, right? So for example, let's take an FSA that ends June 30th of 2021. The plan sponsor can choose to allow up to a 12-month grace period, which would permit coverage for claims that's incurred through June 30, 2022. In addition, there's flexibility for mid-year election changes. So more specifically, prospective election changes permitted without a qualifying event. So prior to this relief, a qualifying event is required to make prospective mid-year election changes. And usually it was very limited circumstances that a mid-year election change would be permitted when dealing with health FSAs. Now, if a plan permits, a prospective mid-year election change can be made without a qualifying life event for both FSAs and DCAPs. Now, there's also relief specific to FSAs, and that would be FSA relief for terminated and furloughed employees that allows them to continue to receive reimbursement from unused benefits through the end of the plan year in which their participation ceased. That also includes any grace period. So employees who cease participating in an FSA, whether they were furloughed during the year or terminated employment, they can essentially spend down their unused benefits through the end of the year in which they were termed. This is temporary and it's applicable only to calendar year 2020 or 2021 and does not seem to require employees to elect COBRA coverage to take advantage of it. Now, there's also relief specific to DCAPs. And that's where DCAPs are now permitted to reimburse expenses for an employee's child, even when the dependent ages out of eligibility. So employers can use unused DCAP funds to be used for children until they turn the age of 14. However, this only applies to the plan year where regular enrollment period for that DCAP ended on or before January 31st, 2020. So we're really looking at aging out during the 2020 plan year. But it also applies for unused balances over the next plan year. Importantly, this relief is optional for all employers. So while a lot of these rules that usually apply to FSAs and DCAPs are certainly relaxed, it's only if the employer chooses to implement the relief. An employer does not have to, but if it does, it should be sure to communicate with employees accordingly and also needs to amend plan documents. Guidance did provide that the amendments must happen by the end of the first calendar year, beginning after the end of the plan year in which the change took effect. So for example, calendar 2020 plan amendments should be adopted on or before December 31st of 2021. And in order to amend those plan documents with a retroactive impact, the plan sponsor has to operate the plan in accordance with the amendment's terms. Now, importantly, employers really should consider how an FSA rollover or carryover, if you will, or a grace period impacts HSA eligibility in subsequent plan years. And this is especially important for employers who might also offer an HSA option. And just as a quick background, because we're pressed on time with all the content we need to cover, a general purpose FSA is considered disqualifying coverage for purposes of HSA eligibility. So for those employers who also offer an HSA option and choose to implement this relief, it should be communicated with employees that extending FSA coverage could very well impact participants' HSA eligibility.
Thank you for that, Diane. I see we have gotten a number of questions on this topic, and I just want to reiterate really quickly, that this guidance just came out, and the IRS did not do the greatest job of providing us a lot of information along with this. So there's going to be a lot of things that we're just not quite sure how it's supposed to work. And we would recommend that you really work hand in hand with your FSA vendors to kind of achieve some of these changes, because we just don't know what that's going to look like. Jill, is there anything pressing that you think we really want to address here?
Yes. So one question is, are all of these changes, could you pick and choose, or is it all or nothing? Great question. You could choose to do some of the provisions and not others. For example, you could allow participants to make changes mid-year without a qualifying event, but not do the carryover or 12-month grace periods that we've talked about. That's up to the employer.
Thank you. And I think that a lot of this, again, because it's optional, we're going to have to see kind of how employers choose to do that. But yeah, we didn't really get any guidance saying that you couldn't somewhat pick and choose. Anything else you want to address, Jill?
There was a question, if all of these are optional for FSAs, or all these changes. I just want to remind everyone that the one provision for a health FSA that remains mandatory is the run out period. And we went over that on the 101. Because a health FSA is subject to ERISA, and ERISA still has that relief right now on claims submissions, and that goes for other ERISA plans as well. But if your plan says claims had to be submitted, let's just say by the end of December, or they couldn't submit them, we're still in a holding pattern on submitting claims to ERISA plans. So that is not optional for a health FSA. You would have to still accept those health FSA claims, and that's anything after March 1st.
Thank you for that, Jill. And I think that's a really good point, and kind of goes back to our, 101 terms and the differences in some of these rules. So thank you for that, Jill. I know that there are a number of questions that still need to be answered. So I'll just reiterate, that we're going to try our best to get to your questions during this webinar. But if we don't, please feel free to reach out to your advisor or to us to get your question answered. So moving along, to some things that I think are a little bit newer and are not necessarily COVID related. We had a number of things that kind of had some bipartisan support, and we're seeing a solution for that. So the first one here is basically this idea of protection from surprise billing. And so just to give you a very quick example, we had issues that were happening across the country and in different states where, let's say I showed up to have a baby. Let's say that I ended up having an emergency C-section, and the hospital had to bring in, let's say, an anesthesiologist who was out of network. I give birth to my baby and then end up with a bill that is usually very high from that anesthesiologist that was out of network. That was the situation that this was looking at solving. And Patrick, what exactly did the bill do here?
Thank you, Beth. This portion of the legislation creates a scheme or a process by which insurers and providers have to work out between them how much the insurer is going to pay that out-of-network provider for emergency services provided to insureds. The insured themselves will be expected to pay no more than what they would have normally paid if it was provided within network. So they're not subject to the surprise billing anymore, and all the action now takes place behind the scenes between the provider and the payer. Insureds will be required to pay only the in-network cost-sharing amount when obtaining emergency medical care from out-of-network providers, and there'll be a formula for that to be established later by the HHS. So we're still waiting for that kind of guidance. And behind the scenes, what happens is that according to this legislation, the provider will present the bill to the insurer, and the insurer has the option of paying it or denying paying it. But even if they deny the payment, there's still a requirement that they negotiate a payment, and they have about 30 days to do that. And if after those 30 days are over and they still have not agreed on a price, then it goes to an arbitrator. And the arbitrator then will take up the matter and come up with a final price that the insurer will then have to pay the provider for the out-of-network service. So if you go to the next slide, please, Beth. Thank you. Now, this process will not apply to providers who provide services to patients under certain specific circumstances. And generally, those are circumstances where if an insured wishes to get a service from an out-of-network provider, and it's not an emergency situation where they may have an opportunity to decide and choose among different providers, then in those circumstances, the provider is not, the out-of-network provider is not subject to this legislation or to this process that I was just describing if they meet certain notice requirements. And as a notice is 72 hours in advance, it has to provide pricing. I don't believe, I remember off the top of my head, that it also requires them to provide pricing for what they would pay in network, and certain other requirements as well. But if they meet those requirements in a written notice, which I believe has to be accepted in writing by the insured, then it would not have to go through that negotiation process that I've described. It also does not, however, this exception also doesn't apply to ancillary services. And on our slide here, we have a list of examples of what the legislation considers to be ancillary services for this purpose, include things like anesthesiology, radiology, and pathology. And in addition to that, the surprise billing section of the legislation has a requirement that all insurance ID cards include plan deductibles for both in and out of network services, out-of-pocket maximums, and plan telephone number and web addresses. It further requires plans to provide, upon request of the participant or the provider, an explanation of whether a particular provider or facility is in or out of network for the service to be provided, the contract rate for that service, and whether that service can be obtained in network. So even though those last two provisions are not directly related to the surprise billing process that I have been describing, it's supplemental to that, and it helps the idea being it helps the insured make an informed decision as to whether or not they want to go in or out of network for that particular service. Next slide, please. Now, one thing I want to add, a couple things I want to add on this one is that the states will actually be charged with enforcing these provisions, and they can impose additional obligations on out-of-network providers that go beyond those established by this federal law. Several states already have surprise billing statutes in place, and I think this is intended to make clear what takes precedence. But if the states don't want to enforce these particular provisions, then the HHS has been charged with that responsibility. And the other thing is, the important thing to be aware of is that this is effective beginning January 1st, 2022. So you've got about a year, or employers have about a year to make all the necessary changes in place to get ready for this process. Now, again, the idea is that the insured themselves, the patient, will no longer get these large bills from out-of-network providers. All the action is going to be taking place behind the scenes, and of course, right now, since this legislation is only 2 weeks old or so, there's a lot of stuff that's still out there that we still need guidance on, and we're still waiting on some additional details to be fleshed out.
Thank you, Patrick. And I think that's really an important point to just hold on to, the fact that, there's going to be regulations that come out on this. I also like to point out here that this is one of those provisions where employer plan sponsors may not have as much of the responsibility on this. I mean, unless you're a self-funded plan that is self-administered, you're absolutely going to be working with your, let's say, insurer, TPA, ASO, or potentially even providers kind of having to comply with this. And so this is just one of those things that employers, I think, are going to watch as it goes on. And so similarly to the protection from surprise billing, there's also quite a bit of bipartisan support for just price transparency requirements. And so we saw that come through the bill as well. Carol, what did we get from the price transparency requirements?
Thank you, Beth. Yeah, there were a number of provisions in the stimulus bill related to price transparency. And just to give you context, and these provisions, I would point out, unlike some of the others that we've been discussing with the FFCRA leave, the FSA, these are not optional. I mean, these are going to be mandatory compliance obligations, and they're not temporary either. So I think it's important to pay attention to these. And these are part of a larger focus we know of our regulators, particularly the DOL, for price transparency. The idea is that, plan sponsors and participants should have pricing information more readily available to them to assist participants in estimating costs of services that they need. But also the other idea is that by disclosing the prices, this is going to encourage competition and hopefully in the long term drive down prices. I think in the short term, as we'll see, there are so many compliance obligations that there will probably be more costs initially. But in any case, those are the goals. So these provisions follow the hospital transparency rule, which went into effect this year, requiring hospitals to publicly display certain prices. And also we had the transparency and coverage regulations issued in October, which imposed new disclosure requirements upon plans and issuers commencing in 2022. And this is related to participant cost sharing, in-network negotiated rates, disclosure of historical out-of-network amounts, and drug pricing data. So these provisions, in some ways, they enhance, they add requirements onto the transparency and coverage provisions, and some are just completely new. The first provision is called the gag clause prohibition, and one of the barriers to the release of pricing information were provisions in contracts that restricted the release of the information. So this new provision is designed to prohibit those types of limitations or restrictions in contracts. So the new gag clause provision prohibits plans and issuers from entering into contracts with healthcare providers, TPAs, or network service providers if the contract would restrict the plan from providing provider-specific cost or quality of care information to referring providers, the plan sponsor, to enrollees, or those eligible to enroll, or would restrict them from electronically being able to access de-identified claims information and coverage data for each enrollee in the plan, and anything that would restrict them also from sharing such information or directing that it be shared with a HIPAA business associate. This isn't a suspension of any HIPAA rules or rules under the ADA or GINA. It's just stating that additional restrictions on the release of information are prohibited in these contracts with the providers. The contracts can include reasonable restrictions on the public disclosure of such information, and plans would be required to submit a certification annually that they are in compliance with these transparency provisions. This particular provision, most of the provisions that we're discussing have an effective date a year from the law's enactment. The law was enacted December 27th of 2020. So a year would bring us to, we're hoping that means early 2022, give or take. This provision didn't have an effective date, so we're assuming that was effective upon enactment. So plan sponsors should review service provider contracts and HIPAA business associate agreements with counsel to ensure that they do not include limitations on disclosures that are prohibited. It's not unusual for these provisions to be included in service agreements. The agreements with prohibited provisions may need to be amended. And employers, as they're in the process of reviewing the contract, should also consider other contractual changes that may be necessary to comply with the transparency and coverage final rule, and also these other transparency provisions that we'll be discussing. It's an interesting requirement. This is a new one, requiring a release of a lot of data from the plan to the federal regulatory agencies, the pharmacy benefit disclosures. Now, this requirement begins annually in 2022, and I think it's going to be in June every year thereafter. Group health plans and insurers will be required to submit detailed reports to federal agencies on pharmacy benefits and costs. These would include, but are not limited to, the plan's most commonly dispensed 50 drugs, the plan's 50 most costly drugs, the 50 drugs with the greatest year-over-year cost increase, total spending by the plan broken down by types of costs, such as hospital and primary care and enrollee spending, average monthly premiums, and the impact of rebates or other compensation paid by drug manufacturers on the premiums. And then supposedly now the information will be compiled by the regulatory agencies in a report that's produced biannually that will show the reimbursement rates, pricing trends, and the role of the drug costs in contributing to premium increases or decreases. So from the plan's perspective, it's a tremendous amount of data they're going to have to collect and forward to the regulatory agencies. The advanced EOB, and this is an additional requirement, I suppose you'd say an expansion of a requirement that's in the transparency and coverage rules. That also required an advanced explanation of benefits upon request by a participant. In this case, it's being required not just on request, but also when the plan receives notice that certain services have been scheduled. So for plan years beginning on or after January 1, 2022, group health plans and insurers must provide an advance explanation of benefits for scheduled services or upon request. It must include whether or not the provider or facility is in network, the contracted rate for each item or service, or if it's out of network, a description of how to obtain information for an in-network provider, a good faith cost estimate of the item or service, including the amount the plan is responsible for paying, and any cost sharing amounts, amounts the insured has already incurred toward the deductible and out-of-pocket maximum, sort of a real-time analysis. Disclaimer that the cost information is only a reasonable estimate, subject to change, and it needs to be provided within 3 business days of receiving a request or notice that a service has been scheduled, but the turnaround time is even faster. It's 1 business day if the notice is of a service that's scheduled within the next 10 days, less than 10 days from receipt of that notice. So employers really want to consult with their TPAs and carriers to ensure timely compliance with this provision. And I would point out, because this is effective as of now, 2022, it's actually earlier than the EOB, advanced EOB requirement that was in the transparency and coverage rules. So that's something to be aware of. Okay, some additional transparency requirements. Price comparison guidance must be available by phone and on the plan or insurance website, so an enrollee can compare cost-sharing obligations for specific items and services from providers. Plans and insurers must maintain a public website directory of all in-network providers and facilities, and it needs to be reviewed and updated at least every 90 days. The plan would be responsible for payment of costs incurred by an enrollee due to inaccurate data. So if, for example, a provider is now out of network, the enrollee would only have to pay the in-network cost if the information was not updated in the directory, and the plan would pay the rest. And there's also additional disclosures regarding the stimulus provisions and prohibitions that are going to be required. So the bottom line here is that participants must be provided information on the cost of health services, and providers, insurers, TPAs, and other vendors are going to have to work together to make this happen. So I think it is really important to be in contact with those parties and start discussing these compliance obligations, because even though many of them are a year away, there's a lot of work to be done. So you just want to get started on that as soon as possible.
Thank you so much, Carol, for talking about that. I will say that, I think that the surprise billing and the transparency and coverage, again, requirements are going to be ones that, again, we know that there's bipartisan support for. So I think that they're definitely going to be something that all of the industry is going to have to reckon with over the next year and over that, I guess. But it's really interesting. So moving on to kind of the next topics. Luckily, the last few are kind of smaller, kind of less, I think, consequential things. And so let's start off talking about the fact that there was a student loan repayment extension. Diane, do you want to talk about that for us briefly?
Sure. Thanks, Beth. So the new law, as Beth mentioned, extends an employer-provided student loan payment benefit to payments made before January 1, 2026. So prior to this extension, the CARES Act allowed employers to provide the student loan repayment benefit of up to $5,250 to employees tax-free. And this is done through an education assistance program. But the CARES Act only allowed this through payments made on or before January 1, 2021. So now the new law is extending it, and the employers can continue to make contributions of up to $5,250 per employee annually towards eligible education expenses. So think student loan assistance or tuition, and this is tax-free through 2025. We do want to note that this extension does not impact the annual maximum non-taxable benefit of that $5,250, but it does extend the benefit for 5 years. So the bottom line and the takeaway here for employers is that if you're interested in providing the student loan repayment benefit, you must do so through a formal education assistance program. So adopting a new one or using a program that's already offered.
Absolutely. And this is also an interesting thing because we put it in the health and welfare section because an educational assistance program is really a health and welfare benefit. But on the retirement side, the IRS also came out with guidance that is potentially going to allow employers to basically work kind of student loan repayment into their matching program. So we'll see that kind of on both sides. Again, I think indicative of the bipartisan support. Thank you, Diane. So now we're just going to go through really quickly a few kind of miscellaneous provisions, if you will, on the health side, and then I'm going to follow that up with the retirement side. Carol, can you talk to us about some of the miscellaneous health provisions?
Sure, I'd be happy to, Beth. The first is a continuity of care protections. This is part of the No Surprises Act. And the idea here is that if a seriously ill individual is receiving in-network care, and then the plan's contract with that in-network provider is terminated, that they would have the option to elect transitional coverage. And the coverage would allow for continuation of benefits for up to 90 days at the in-network rate, even though the provider is now out of network. So the provider wouldn't be able to balance bill the patient. They'd have to accept the payment at the in-network rate as payment in full for that period. This would only be extended, this option, to certain patients who are receiving treatment from a provider for a serious and complex condition, or for institutional or inpatient care, or be scheduled for non-elective surgery, pregnant, or terminally ill. And then the next provision, it's an NQTL analysis requirement. This pertains to the ACA federal mental health parity requirement that mental health and substance use disorder benefits need to be offered on parity with medical and surgical benefits. The particular focus here is non-quantitative treatment limitations. Examples of these would be medical management requirements, step therapy protocols where maybe you have to have certain treatment outpatient, let's say before you receive inpatient treatment, experimental treatment exclusions. So any health insurer or group health plan that imposes these NQTLs on the benefits must perform and document an analysis of the design and application comparing those applied to mental health or substance use disorder benefits in comparison to those imposed on the medical or surgical benefits. And the analysis must be available to the state and federal regulators on request, along with the supporting data. And fortunately, the regulators are required to provide additional guidance, including a document with illustrative examples to help promote compliance. And I believe there's an expectation that additional guidance will be provided within the next 18 months.
And to just give a quick primer on why we got to this point with non-quantitative treatment limitations, I was actually at the DOL when mental health parity was kind of really kicking up. And one of the things that we were running into as investigators is that a plan would generally, let's say, have some non-quantitative treatment limitations. So let's say that they would limit, certain type of mental health visits to 5 visits. And then after that, you had to have pre-authorization. When we as the DOL went to the insurer and said, okay, why do you have this? It's clearly not in parity. Why is it that you think this is going to fall under the law? The insurer often said, oh, just based on our kind of, let's say, proprietary, analysis of the situation, this is in parity. And so I think this is really kind of getting back really at insurers for the most part, basically making it clear that for these non-quantitative treatment limitations, they actually have to come out with the analysis and the numbers behind them having any of these limitations.
Thank you, Beth. That's very interesting. The next requirement, service provider disclosure requirements. This is interesting because this is really a requirement that's been in place. If any of you work with retirement benefits at all, since back in 2012, the idea is that an ERISA plan sponsor has an obligation to make sure that service providers' compensation for the services they provide to the plan is reasonable. That's a fiduciary obligation. If it's not reasonable, it's not complying with ERISA and the prohibited transaction rules. So that's what this is about. So prior to a contract or renewal date, plan service providers must disclose to the plan fiduciary any compensation, direct or indirect, they will receive for services provided on behalf of the plan. Applies if the providers receive $1,000 or more in compensation. The disclosure would include, amongst other things, the statement of the services provided. They would have to indicate if fiduciary services are being provided, and all expected compensation, whether transaction-based, an incentive, commission, etc. This reflects an extension of the ERISA's 4A/V2 fee disclosures to health plans, and this is effective 1 year from the law's enactment. So again, that would be around January 1st of 2022, and additional regulations are expected. And then finally, there's an extension of a tax credit for employer-provided paid family and medical leave. This is under the Tax Cut and Jobs Act of 2017. Provided the credit for employers that provide paid family and medical leave to their employees under certain conditions. And the stimulus extended the credit through December 31st, 2025 for wages in taxable years beginning after December 31st, 2020. The rates are much less than the FFCRA in terms of the credits, the percent of wages that we reimburse. Would range from 12.5% to 25% based on the rate of payment, and the maximum amount of leave that can be taken with respect to any qualifying employee is 12 weeks per tax year. So separate and distinct from FFCRA leave tax credits. More information as far as the eligibility is, there's some good information on the IRS website, or a plan can talk to their counsel or tax provider.
Thank you, Carol. So we're going to end it out just talking about the few retirement-related provisions that we got from the bill, and they are few. And I want to remind you that I think one of the reasons that we didn't get a lot is because this time last year, the appropriations bill from 2020 technically included the SECURE Act, which was the biggest piece of retirement plan legislation that we have ever had, or I shouldn't say ever had, let's say at least in the last 15 years. But basically, in that year's time, we already have bipartisan support for potentially a SECURE Act 2.0. that would come in and actually change some of the Secure Act. And so because that is already somewhat moving its way through Congress, I think it was introduced in a House committee already, we did not see a lot of retirement provisions in this particular bill, okay? But we did see a few things that are, one of which is related to COVID, one which is quite isn't, and then just a few things that they just threw in. And so quickly on partial plan termination, there's basically a requirement with retirement plans where if an employer, let's say, gets rid of at least 20% of their workforce, then it's considered a plan termination. And if they have a vesting schedule where employees are not vested in their employer contributions, let's say up to 6 years, then they basically would have to vest those employees who were terminated as part of that partial plan termination at 100%. And so the rule here basically comes in and says, okay, in 2020, a lot of you had to furlough people, because of COVID. And they're going to kind of change the rules in that regard and say that basically this upcoming March 31st, 2021, if an employer has at least 80% of the active participants that they had last March 31st, then essentially it would not have been a partial plan termination. Now, like a lot of the things that we got in this bill, this is kind of retroactive in nature, and employers might have already kind of made the decision that they had a partial plan termination and distributed people out at 100%. Getting that money back from them is probably not possible. But if you were an employer who, let's say, has some distributions that have not been done, then you could potentially do this analysis to figure out whether or not 100% employer contribution vesting would be required. This is one of those things you're going to want to work with your plan advisor on for sure. And then also, interestingly, they kind of threw in some disaster-related distribution and loan relief, if you will. If you remember back to the CARES Act, the government allowed for employees or participants to take basically hardship distributions and additional loans amounts up to $100,000 for COVID reasons. And so what they were saying here is actually if there were any disasters throughout the year that were not actually COVID related, but were FEMA declared disasters, then that same guidance from the CARES Act would essentially apply to those hardship distributions and loans. And so it's just going to allow for participants to essentially access more of their retirement because of disasters. And then also there was a provision that said that money purchase pension plans could actually allow the same relief that we saw in the CARES Act. And so that's another retroactive thing. So money purchase pension plans weren't allowed by the CARES Act, and now they are. So if you had any employees who did, let's say get terminated and take a distribution, then potentially, these rules would apply to them, but it is kind of retroactive in nature. And then these three things that we see on this tree here are kind of very specific things. I won't even talk about the top two because they're very specific to certain situations. But this last piece is that they included in here the requirement for the DOL to basically create a report on the impact of the 2020 electronic disclosure regulations. And so some of you might remember that last, I think, June, the DOL finalized rules that basically provide another safe harbor that will allow employers to give out everything for their retirement plan electronically as the default. They did not extend that to the health plan. So what we are hoping is that this requirement to kind of report back on it will be their way of justifying this also being done on the health side as well. And so just for some final thoughts, because I want to save at least a couple minutes for questions because I know we got a ton of them. This bill is brand spanking new, and I just couldn't think of another way to say that. We tried our best, to explain a lot of the provisions and especially explain where employers would need to do things. But, there's going to be a lot of guidance coming from the government that is going to indicate what this is really going to look like. Okay, so it's one of those things where we all just need to hold on to our seat to see, what's going to happen with some of this stuff and how the regulations are going to affect the implementation of these provisions. We tried to bring this up during the presentation, but a lot of this had kind of bipartisan support, so for those of you who know kind of where we are in our country right now, as in today, that we have a new presidential administration coming in, that we potentially have a democratically controlled Senate that is going to be coming in, but I don't know that any of the things that we really talked about today will really be changed just because of the fact that these are not really things that I think the two parties are arguing about, if you will. I think specifically with the surprise billing, and the price transparency. We might see a little pushback from the industry on that piece, because that's going to be a lot of work for them, specifically insurers and providers. That doesn't mean that the litigation will be successful. And at the end of the day, I think you all know as plan sponsors at this point that they're just probably going to try and find a way to pass the extra costs on to you for all that work they have to do. But there is the potential for some litigation. And then finally, we will continue to follow these issues and just provide any explanations of guidance. Now, everyone, it is about 2 minutes to 3 Central, and we want to be respectful of your time. And so this is kind of the end of our, let's say, specific conversation. And if Leanne, if you could just link the chat, or in the chat, link to the white paper that we actually wrote on all of these provisions as well, and you can access that or ask for it from your advisor. But I hope that some of you, if you're amenable and do want to stay to hear some answers to questions, I hope that the team is okay with maybe just sitting on the call for another 10 minutes or so if we need to answer, any good questions. So Jill, anything you have that you definitely want to bring up?
I do, and it's one of the questions that we're not entirely clear on, or maybe it's a situation where I'm not entirely clear and somebody else can answer it. But it's the situation with the health FSA spend down. So the question is, if I terminate the health FSA mid-year and and as an employer, they offer the spend down, do I have access to the entire election amount under the uniform coverage rule, or do I only have access to what I've contributed? And I don't know the answer to this, and I don't know if it's clear in the law. This is usually the level of detail that would come in regulations, because the law refers to DCAP procedures. Well, if we look at DCAP procedures, you only get access to the amount that you contributed. But, and maybe that's where this would be an alternative to COBRA, because COBRA, of course, you have access to the full amount, but you're paying for it. In this spend down, you would not be paying for it. So it seems that maybe you would only have access to the amount you've contributed. Any thoughts from the team? I'm saying we don't know yet.
Well, so I would actually go back to the regular FSA rules and how it normally looks, right? Because when someone terminates mid-year regularly, they basically, their eligibility stops for the remainder of the year, right? Unless they elect COBRA, in which case they could get the entirety of the amount. And so I feel like it would be tied to that concept, in that when they're terminated, they lose their eligibility. And so they would only really be entitled to the amount that they contributed. I don't know that they would be entitled to the rest of it, because their eligibility would stop.
I agree.
No? Yeah.
That would be the difference in the COBRA. You are buying into the uniform coverage rule, and you're able to continue incurring. In this case, you could continue to incur, but you would not have access to the full amount. And that would make sense why it's different than COBRA. It just wasn't spelled out that way.
Yeah. Yeah. But I mean, that's definitely a good question. And hopefully the IRS will give us some guidance on it. But I think that just knowing how they tend to maybe move, I would think that they're going to kind of rely on the way that FSA is normally, right? Maybe.
Yeah, not only sometimes it doesn't make sense what they do, so it doesn't have to necessarily be logical when they give us the answer.
Mm-hmm.
The other question that came up quite a few times was self-insured plans and the surprise billing. So I'm going to call Patrick back up here. My understanding is that the law said it applied to insurers and plans, indicating that it would also apply to self-insured plans. What are your thoughts, Patrick?
I agree with that, Jill. I think that it's going to apply to anybody who pays out these claims. So it's going to include self-insurers as well.
Yeah, and a lot of the state surprise billing laws do not apply to self-insured plans because of ERISA preemption. but
Right.
this would most likely apply to self-insured plans. That's what we're thinking now. I got quite a few questions on HSAs. Are there any changes there? With the HSA, it's just a continuance of the previous relief. The HDHP can provide benefits for telehealth, COVID treatment, COVID testing before the statutory deductible, and still maintain the participant's HSA eligibility. And then the over-the-counter drugs and menstrual products are reimbursable as a qualified medical expense. So nothing's really changed there. It's just a continuance of the same. Chase, what about you? You were answering the other half of the questions.
Yeah, most of the questions I saw had to do with kind of the interaction with the FSA spend down and the carryovers, and whether you could adopt one. There's one that came up that said, could you adopt a carryover if you had to spend down before, or a grace period if you had a carryover, kind of switch midstream. And then the other one is the interaction with HSA eligibility, which we were discussing as a team, what happens if you extend that grace period for the 12 months or you have the carryover, that's going to adversely impact somebody when it comes to their HSA. So we have reached out through our industry groups, our lobbying groups that we're associated with, to see if we can get the IRS to put out something on that, maybe provide some relief, maybe say for 2021 or for these situations at least, the HSA won't be adversely impacted, but we'll have to wait and see on that. So
yeah, I had a lot of questions on that too with the HSA eligibility. So remember existing option is if you have a qualified high deductible health plan and an HSA option, and then you have a health FSA as well. If you have a carryover provision in the health FSA and somebody wants to change the next year into the HDHP/HSA, you can design your plan so that the rollover amount, the employee can forfeit it. They don't take it, so they maintain their HSA eligibility, or they can roll it over into an HSA compatible FSA, just that rollover amount. So then they could still have access to it in a post-deductible or limited purpose FSA.
yeah, good point.
So lots of questions here, and I really appreciate everyone attending. As we kind of have said over and over, this is new and we're all trying to work through it, and we know that you all are having a hard time trying to work through it as well. But it is our hope that we can serve as the resource. And like I said, as all of the guidance comes out, we will continue to put out pieces. In addition, I said on the onset of the conversation that we were only talking about the benefits related, implications of the bill. NFP may have some, later presentations, maybe later in the month or the coming weeks, that go into things like the PPP and the COVID vaccine and things like that. And you just want to kind of keep your eyes and ears open as that comes. With that, let me thank all my teammates for working on this, getting through the 5,600-page bill or whatever it was to provide this information today. And as always, Leanne, thank you so much for your help today. Are there any closing thoughts that you have, Leanne?
No closing thoughts on my end. As always, I just want to thank the team, Beth, Patrick, Carol, Diane, for sharing your valuable time and expertise with us today. As a quick reminder to our audience, today's presentation was recorded, and within 2 business days after this call, you'll receive a follow-up email from NFP Learning with links to both the recordings and the slide deck. One more time, I'm just going to share that white paper resource in the chat box, which will also be shared in that follow-up email. And with that, that concludes our webinar for today. We thank you all for joining us, and we hope you have a great day.